Good morning, everyone. It is time for another edition of Weekly Wellness. It's your girl, Comedian Joy, and I'm joined by the amazing Dr. Mia Cowan of Me Bella Wellness. We got a good topic to talk about today because, we got a whole bunch of myths going around, and I'm glad that we talking about this vajayjay. We talking about how you keep that thing clean. Do you need tussin down there? Do you need a bounce sheet, or do you just need to let that thing go? But first, I gotta see how my girl Dr. Mia is doing because it's been a minute. When I saw you when I got my pellet, you were already had your car in reverse, honey. So how have you been doing, Dr. Mia?
I am fantastic. Hey, comedian Joy. Thanks for joining me today. It's been a minute, hasn't it?
Yes, but it's always a pleasure, and I always learn so much. So today we're going to be talking about that, vaginal tissue. And I always believe if the Lord gave you one of something, you got to take care of it.
That's right.
Let's talk about a couple things. So one, let's talk about soaps. How should we clean it? See, when I was a kid growing up, we had all that Massengill, all that vinegar and water, all the flavors, and people want to put strawberries and all that stuff in there. But as I've been hanging out with you and learning, you said just wash that thing. What we need to wash it with?
Yes. So my recommendation always is for women, if you use soap, which I do because I don't feel comfortable not using soap. What you're really cleaning is the outside, so the vulva. So what sweats and can cause odor is really more so on the outside. If the inside is causing odor, it's because there is a concern or a problem that we'll talk about in a second. So Dove White Bar, either the sensitive or the original soap I have found would be the soap that my patients who don't come see me often for bacteria and yeast use. My patients that are always coming for bacteria and yeast, 9 times out of 10, they have used the wrong soap. So something as simple as soap can actually prevent bacteria vaginosis and yeast infections, which can cause odor and which can cause a change of the vaginal tissue that we don't necessarily want.
So let me ask you, for some people who, may like to use a lot of the Bath and Body Works, more of the scented things. So you're saying don't use that down there.
Don't use that down there. And even me, like I use the Dove White Bar to clean my entire body, including my Yoni area. We'll say Yoni so that the Facebook police don't give us a hard time. I will use that and I don't have any problems. It doesn't change the pH level or anything. So the Dove White Bar soap, some people don't feel comfortable using any soap, but if they're using the Bath and Body Works, even if they use the Dove Body Wash, it's going to increase the chance of changing the pH, and they're going to be more likely to get bacteria vaginosis. So what happens is a lot of people are using the wrong soap, and so they notice this funny odor. So they're always trying to use other things to get rid of the odor, when in actuality, if you would use the right soap that kept your pH nice and balanced, you wouldn't have the odors that you're talking about. Because usually if your vagina has an odor, it is because of a change in pH or a sexually transmitted infection or the change in pH causing bacteria or yeast. And the final thing that's very common is as we age and mature, the vaginal tissue changes. The estrogen starts to decline in our system, but it also starts to decline in our vaginal tissue. And as a result, women will have the similar symptoms as bacteria vaginosis. So they'll notice a change in odor. They'll notice a discharge. They may notice some discomfort with intercourse. They may notice a little bit more cramping, but they do notice a change in odor. So with that, we actually start treating the tissue when you're younger, using something topically on the tissue like a hyaluronic acid, a vaginal estrogen, or a vaginal DHEA to prevent postmenopausal atrophic vaginitis, which can actually happen to women much younger, depending on hormonal birth control, depending on just age in general, and depending on how quickly the vaginal tissue starts to age. So as your hormones decline and you're having the symptoms of perimenopause, a lot of women would start to notice changes in the vaginal tissue, but we can easily prevent that and treat that.
So let's just be real and talk about it, because a lot of times we have made jokes about women may smell fishy or negative connotations. So is there a healthy smell? And then what are smells that we should be concerned about?
That's a very good question. So I think most women start to notice what their normal smell is. And when I say smell, I mean out of the shower. So if you go walk all day and you work all day and you walking around all day, you are definitely going to notice a change in the odor there because of the sweat. And that's what I was talking about, the outside sweats, hair holds odor, all of those things. But normally, you really shouldn't have much of a smell when you go to the restroom. If you do, more than likely your pH is off, or there's some kind of infection going on that we actually need to treat, or we need to treat the vaginal tissue with the vaginal estrogen, the vaginal hyaluronic acid, or the vaginal DHEA. So most women know their normal smell, which is not much of a smell at all out of the shower. But everybody's gonna notice at the end of the day that if you're sweating, your underarms aren't gonna smell the same at the end of the day as they did right out of the shower. Same with your vagina. So making sure that you clean the area good. Other things I tell ladies is you can use the baby hypoallergenic wipes. In the summer, we sweat a lot. We may notice a change in smell with the sweat. We notice a change in smell, especially on the outside. So even in between using the baby hypoallergenic wipes, when you go to the restroom, when you're older, urine changes. It doesn't just have a straight flow and stream. So a lot of women will notice that when they urinate as they're older, they can't stand up and urinate like they used to because it kind of goes everywhere, all over the leg. So that's when those baby hypoallergenic wipes come in handy. After you go to the restroom, clean the area around your thighs, around the outside of the vaginal tissue really well so that you don't have the odor. But again, 9 times out of 10, if you're having that fishy odor that keeps coming, and then what happens is women start trying to treat the odor. So then they start douching. Wrong. Do not douche. Never douche. Douching is bad. It changes the pH and causes bacteria vaginosis, which is why the women who douche and who use a lot of those soaps always feel like they need to clean and do something extra. Now, y'all know I love my companies. I love my small businesses, but there are a lot of things out there that people are having to pay co-pays to see me frequently because they're using. So any of those body washes, even some of the name brand feminine washes, some of the pH balancing washes, some of those Vagiseals and all of those things that are supposed to be used to help the vaginal tissue tend to cause more of a problem than a help. And when my women notice that if they would just use the Dove White Bar soap, the original or the sensitive, if they would use the baby hypoallergenic wipes in between, meaning wipes with nothing else in it. And then sometimes if you're irritated or feeling dry, you can use the organic coconut oil on the outside. And those 3 things do not change the pH where you're more likely to get the discharge with the funny odor. With the fishy smell, usually that's going to be your bacteria vaginosis. It's caused by a change in pH. Things that can change the pH, even what you wash your underwear in. So I use detergent anyway that doesn't have a lot of stuff in it. It's some of the clear and free. So I use that anyway. But a lot of times, even if you're using the right soap, if you're using those really loud smelling scents to wash your underwear and your underwear are right up against you, that's going to change your pH and cause bacteria vaginosis too. The pads and the tampons that have the smells to make them smell better, those things are going to cause a change in the pH as well. And then as far as douching, I don't believe in douching, but for women who have different pheromones, some women just have stronger pheromones, so they always feel like they have this odor when it's really their pheromones. So for those women, outside of using the baby hyperallergenic wipes and using the Dove, I do sometimes recommend my little grandmama remedy. And that is where you take a bottle of water and you pour out a third of it and you refill it with white household vinegar. You're not pushing that on the inside of your vagina, but what you're doing is cleaning the outside. And that acid in the vinegar will actually keep your pH low enough so you're less likely to get the bacteria. Because what some women complain about is that after intercourse, because sperm is basic, after intercourse, they notice that they get a funny smell or they feel like they get bacteria. Some women notice with the change in hormones. So when their cycle comes on, they feel like they get a yeast infection every time. More than likely, using a Dove White Bar Sensitive Skin soap, the baby hyperallergenic wipes, the organic coconut oil, doing a grandmama wash where after you clean with all of that, if you feel like you need a deodorizer, shake that 1/3 of vinegar to 2/3 of water up, pour it on your washcloth, clean the outside. That is a great deodorizer. But then the other thing that helps is when you start treating the vaginal tissue. So by using the vaginal hyaluronic acid, that you can actually order online that helps significantly with keeping the tissue healthy, lubricated, sensitive, orgasmic, and it also decreases urinary tract infections. It also decreases the fall down of the bladder and the rectum as you age. So we should be using something topically at least twice a week, starting to me at the age of 40. If you are on birth control that's hormonal, you can start earlier. But just putting something in vaginally at night, right before bedtime, either a prescription that I write you for the vaginal estrogen or DHEA, or a medication that you can get online that's all natural. The hyaluronic acid that we use for our face, we need to treat our vaginal tissues like we do with our faces. So as we age, we're doing everything we can to stop the wrinkles. As we age and mature, we need to do everything we can to maintain lubrication, sensitivity, orgasmic tissue, the tightness of the vaginal tissue, and it also decreases urinary tract infections as well as leakage of urine with coughing, sneezing, jumping, laughing, as well as urgency and frequency. So that vaginal tissue plays a huge role in not just your sexual function, but also in your bladder symptoms, as well as just your vaginal anatomy and tissue.
So you've said a whole lot.
A
So
whole
basically, if when you're older, you may smell, so you need to wipe the top of it. And if you're wearing them diapers, you're gonna have to change them diapers so you don't be going around smelling too much.
right. And
So
then things you can do to prevent having to wear the diapers would be starting to treat that vaginal tissue now. You know, keeping the vaginal tissue healthy and strong. It's the weakness of the vaginal tissue that can actually cause the urinary symptoms like the leakage of urine where you're having to wear a diaper because when you cough and sneeze, you leak, you know, or the urgency, gotta go, gotta go, gotta go. All of that stuff starts after changes in the vaginal tissue, which can happen right after you have a baby or after you're pregnant, but can also happen when you start hormonal birth control and can also happen just simply with age and maturity. But there are things we can do to prevent this because it can negatively affect not just your quality of life, because nobody wants to urinate on themselves. Nobody wants to smell like urine. But also the sexual function component is very important to maintain healthy sexual function, to treat that vaginal tissue, keep it young, healthy, sensitive, and orgasmic and lubricated.
So, two questions I have are two-parters. So, what about those Yoni pops? And also, what's that thing that people talk about? They like to go. I know they have it in Atlanta and sit in this pool that's supposed to clean you and all that. You lay
So like
naked.
the Yoni steams.
Yeah, it's that, and it might be another word for it, but I've heard a
Yeah,
lot of people talk about it. They go to this place in Atlanta
and
and
they
like
sit on top of it at the Jeju spot, and the steam
that's it.
comes up, and then it's
Yes.
supposed to help detoxify and all of those things. And I don't think that it harms anything. I don't know how much it actually helps because what I find as a gynecologist that I don't need to really do much of anything if I'm initially using the right soap and doing the proper care. But I do treat my vaginal tissue on a regular basis. For my patients who are older and they didn't start treating their vaginal tissue, they're already having a dryness, they're noticing the discharge because of the postmenopausal atrophy. Once they start treating the vaginal tissue, if that alone doesn't work, that's when those other wonderful procedures come in, like the O shot, as well as the O wave, as well as the hydrogel, as well as vaginal rejuvenation. But now we can use the O shot really as vaginal rejuvenation. And the thing that's different about the O shot compared to just vaginal rejuvenation is the O shot is where I take your blood, spin it, take all the good stuff off the plate, the plasma rich plasma, the platelet rich plasma, which has the growth factors in it. And then once I do that, after I numb you topically and do a clitoral block, I can put those great growth factors and that platelet rich plasma into the clitoris to increase clitoral orgasms. But I can also put it in the G spot, which is in the vagina, to increase vaginal orgasms. And so the combination of placing that O shot means that it's not only going to help with lubrication and tightening of the vaginal tissue and orgasms more intensified, more frequent. It's also going to help with that leakage of urine with coughing, sneezing, jumping, laughing. It's going to help with urgency. It's going to help with frequency. It's going to help with tightening, and it's going to decrease urinary tract infections. So if you've already gotten to the point where you're noticing a change in your function, it's harder to have orgasms, you're not having orgasms, or they're very infrequent, then not only treating the vaginal tissue topically will help, but also doing some of these wonderful procedures. The O-Wave is another procedure that's non-invasive that everybody forgets about. It's great for my younger women who are just starting to notice some changes, but they're not very severe. They can do a O-Wave like every 2 to 4 weeks, and that will help maintain the lubrication, the sensitivity. And then we also use that O-Wave when we do the O-shot, and we also use the O-Wave in between for maintenance of the O-shot.
So how about, I feel like it's an obvious question. What about having too many sexual partners? Wouldn't that affect the smell or your pH balance?
It will, especially if they bring along other infections. You know what I mean? So definitely, if you have a sexually transmitted infection, so if you're having abnormal discharge, you're noticing an odor that every time after you shower, even right afterwards, you start to notice that odor again. You should see the gynecologist so that we can do testing. And that testing is a swab that we send off. It will tell us exactly what it is, whether it's bacteria vaginosis, whether it's yeast. Yeast is also caused by dark, moist environment. So if you go work out, leave the wet clothes on for a long time, that's going to increase your chance of a yeast infection. If you are on antibiotics and some diabetic medications can increase your chance of a yeast infection. And then, what you're eating and what you're putting in your body makes a big difference too. And if your blood sugars are out of control, that can cause more yeast infections. So usually, in order for you to really tell whether it's bacteria, yeast, or another sexually transmitted infection, it requires you getting that swab or getting a wet mount done in the gynecologist or your family practice doctor's office, so that they can run it and see exactly what's going on and treat appropriately. Which is why when our patients call in, especially when they're like 25 or 26, and they're like, I got a yeast infection, can you call me in something? I'm like, no, you can come into the office so I can confirm that it's a yeast infection, because it could be a yeast infection with another infection that needs to be treated with a different antibiotic. So seeing your doctor, making sure that if you're noticing any changes in your vaginal discharge, in your odor, and in your pH, because you're noticing a change in odor, you're noticing a change in discharge, just see your gynecologist, let them do a swab, diagnose, and then to prevent all of those different unwanted infections, whether they sexually transmitted or just basically pH balance, you're going to use that Dove white bar soap, the baby hypoallergenic wipes. You're not going to use all those great smell good things. And if you do use them, you're not going to use them when you're in a sit down bath, and you're not going to allow that to get near your genitals, because that's going to increase your chance of getting BV or yeast. And then as you're aging and maturing, you're going to treat the vaginal tissue to prevent the dryness and the thinning of the tissue that can cause the atrophy, is what we call it. And we can easily prevent that and treat that with topical treatments that you can put in vaginally at night.
So let's dispel the myth. Should we or should we not sleep in our underwear? Should we let that thing just air out at night? Because don't it need some fresh air?
I think it's different for everybody. Like for me, I have to sleep with underwear on. For some people, they can't sleep with underwear on, but I just think it's comfort wise. You know what I mean? And it depends on how you sweat too. Because for me, at night, if I'm going to sweat more, be hotter, then having some cotton underwear to absorb the sweat keeps me from feeling irritated. And for other people, they just feel like they need to air out. They don't have a lot of sweat. They don't have a lot of necessarily natural juices that could be irritating, or some people just have more discharge, so sometimes that's irritating if it's not something catching that discharge, even when it's normal discharge. And discharge is healthy and wanted as you age and mature. When you're young, you're like, I don't want to see discharge. As you get older, you want to see a healthy white or clear discharge to let you know that your vaginal tissue is being treated well and you're still producing lubrication, so that when you are intimate, you don't have discomfort, and it's easier for the tissue to stay sensitive and orgasmic so that you can enjoy more. So you do want that natural lubrication that you should get if your pH is right and if your tissue is being treated correctly with hormones versus hyaluronic acid.
Now, you mentioned before I asked the last question about things being like in a hot bath. Should we be concerned, like during the summer, we may like to go swimming, we're in the pool, we're in jacuzzi?
Yeah, that increases. So, and that's hard, because when I go to the pool, I'm in and out of the pool, but sitting in that wet swimsuit can increase the chance of you getting a yeast infection. So I just say when you work out, as soon as you can change your wet clothes, change them. And if you're doing the pool thing, sometimes you might just want to just get you a little over the counter yeast infection medicine to prevent it, because you know you're going to be sitting in a wet bathing suit for a while, and that does increase the chance of you getting yeast infections, which can be very irritating and very uncomfortable during physical intimacy.
So basically, as soon as we're done in the pool, we need to try to get out of that.
Yeah, just get out of the wet clothes. Now, if you laying out at the beach all day, it's not much you can do. You know what I mean? Because you're still going to be, in that wet swimsuit for a minute if you do get in and out of the water, which is fine. But sometimes what I tell my patients is just to go ahead and have your little over the counter. After you finish at the pool, then go ahead and treat the vaginal tissue to prevent yeast. And if you start noticing some itchiness, you know that it's from there. And then when you work out, change those wet clothes right away. So don't drive home from the gym, go to the grocery store with your wet, sweaty clothes on. Just take some dry bottoms or some dry shorts. And then once you finish working out, just dry off well and put on the dry things so that you don't get a yeast infection from the moisture from sweat.
Interesting. Yeah. Okay. Well, this is good stuff right here. Yeah. And again, I think it's all about knowing your body.
Yeah.
Because downy is terrible for me.
Yeah.
They're under the arms. So one of my good friends, they would soak their towels in downy. When I went to go visit them, I literally took my bath cloths.
Yeah.
I couldn't do it.
And everybody's different, but that's the importance, when we're aging and we're maturing, understanding your body and the normal changes that occur so that we know what to do to prevent those normal aging changes that we don't actually want. So I don't want to have dry yoni just because I'm aging and maturing, and we can prevent all of those things with proper care, proper cleaning, using the right detergents. Cotton panties, are going to be very helpful for decreasing yeast infections, especially during the summer when you're sweaty. Using a panty liner, which has no odor or nothing extra in it, just a plain old hypoallergenic panty liner will help keep the moisture from the vagina, which will help decrease the chance of getting yeast infections as well. So, caring for the vaginal tissue like you do your face is something that requires treatment and prevention. And if you're noticing changes, making sure you know exactly what's going on. And another thing, y'all, get screened. Like when you go to the gynecologist, I'm in a very happy marriage. Me and my husband been together for 25 years. We'll be 20 years this year. We work together. I still get my screenings when I have my annual exam. I still get screened for sexually transmitted infections, and I like them to make sure I don't have yeast or bacteria if I'm having any symptoms. Still get your screenings, because so many sexually transmitted infections do not have symptoms. So it's not that you're saying that you think your husband is cheating on you. Just get your screening so that you can know what's going on and maintain a healthy vaginal pH, because a lot of times you don't know unless you're getting your screenings. So screen for chlamydia, gonorrhea, trichomonas if you still have a cervix. If you don't have a cervix, if you've had a hysterectomy, you still should get screened for trichomonas, because those are infections that a lot of my patients don't come in complaining of any symptoms. It's just the screening that shows me that they actually have something going on that can easily be treated.
Hold on, Dr. Man. Hold on. How you gonna get some of them if ain't nobody stepping out? How that work?
Well, I'm just saying, a lot of people who have significant others stepping out don't know they're stepping out. So they're just assuming that they're not, and they're not getting screened. And they almost feel like it's offensive or insulting. But what I say is just get screened. I mean, if you're having sex, it's a chance that you could have contracted a sexually transmitted infection. And like I said with my husband, I don't think he's out doing anything, but I still get my screenings. And it's not going to hurt for it to come back negative. The problem is, especially with our younger girls who don't get screened, they can have chlamydia, gonorrhea. They're at high risk for that. And those things can affect fertility, and they can cause pelvic inflammatory disease. So especially when you are not in a monogamous relationship, and even when you are, just get your screening so you know what's going on with your girl, and you can maintain a healthy yoni so that you can have everlasting intimacy.
And then if that test come back some kind of way, you just have to pull out one of them drawers and be like, look here, we finna close this practice for about an hour. We about to go toe to toe.
I know. And then you'd be surprised at how many women, and no, you cannot get trichomonas from a toilet seat. Trichomonas is one of those grown women diseases. That's what you see in like the women in their 20s and 30s and 40s and 50s and 60s. Like you rarely see chlamydia and gonorrhea in women over 40, 50, 60. But trichomonas is the one that we see on a regular basis. But nobody knows they have it unless they get screened for it. And you get it only sexually. You do not get it from a toilet seat, and men always test negative. So if somebody tells you you have trichomonas, whoever you're sleeping with needs to be treated, or you're going to keep passing it back and forth. Trichomonas won't make you sleep. Won't make you sick. Chlamydia and gonorrhea can. But trichomonas is a nuisance, and it's something that's very contagious. So if you have it, you need to be treated. You need to have your partner treated, and it's only gotten sexually. So when you go home and your husband or your boyfriend tells you that they don't have it, they came up negative, they always test negative. They still need to be treated in order for you to get rid of it if you're going to continue to have unprotected intercourse with them.
So what are the symptoms? Just you don't.
Women don't have symptoms. Like I may notice the symptoms, especially if it's a new trichomonas infection. I can see things on exam, and it's a certain odor. But a lot of women don't know they have it. I've had women to come in and haven't had sex for 10 years, and they're like, "What?" But they haven't been to the doctor either. So that's another conversation. And they still have trichomonas because it doesn't go away unless you treat it. And a lot of women don't have symptoms, or don't recognize the symptoms because now it's been there so long, they don't notice that it's a different odor or a different discharge. And again, a lot of women just don't have symptoms, and men definitely don't. And a lot of times, depending on how they test men, it's gonna come up negative for them. So if you know that the only person you've been sleeping with and you've been getting your exams on a regular basis, because if you get a pap smear, trichomonas is gonna come up on that pap smear as positive, whether we screen for it or not. So if you've been getting your regular exams and your testing has come back negative, and you sleep with somebody and come up with trichomonas, that's where you got it from, the last person that you slept with, if you had a negative test the year before.
Or
any person that you slept with after that test. It could be several people that you could choose, because it's a whole new revolution on how we're intimate now. And there's a lot of freedom around that, but still be careful, use your condoms. Get your screenings on a regular basis. Treat your vaginal tissue like you treat your face. It's very important. It's a very important organ. We need it for everlasting intimacy and to be able to enjoy intimacy and continue to have great orgasms, but also just for your bladder function and making sure you don't have leakage of urine, and to make sure you can remain continent, because incontinence is another reason that people end up in a nursing home compared to being able to stay at home as they age. Because if you can't maintain your urine and you have a lot of incontinence, that causes a lot of skin breakdown. The care for that person is going to be different. So everything that we can do to prevent these things, like cleaning with the right, soap, making sure we're treating the vaginal tissue so that it doesn't become thin and it doesn't become a problem with our bladder. Those are the things that we can do to maintain everlasting intimacy, but also to age better. It's going to be better to treat the vaginal tissue, screen the vaginal tissue when you go and get your screenings, screen for sexually transmitted infections. And if you're noticing a change in your pH or a change in your odor or your discharge, see your doctor so that we can figure out exactly what's going on. And I've given you all the secrets for maintaining a healthy pH, so you're not getting those nuisance things over and over and over that can easily be prevented, like bacteria and yeast.
Well, there you have it. So when you're older, that old pee, it just ain't gonna work. You gotta change that diaper. It's gonna tear your skin up. So you want to prevent all of this stuff now while you're young and healthy. Can be putting all them bounce dry sheets down there. Just keep that thing clean and not too many people in there.
Right.
I think go and see your doctor. That is what
see your doctor. Get your pap smears. Get your screenings. See your doctor on a regular basis. So y'all know who I am. I'm Dr. Mia at Me Bella Wellness Center, where we offer gynecology to women and adolescents, as well as hormone pellet therapy, weight management, total wellness with supplements, intimacy solutions like that O-Shot and stuff I told y'all about, as well as laser hair removal for both men and women. Our goal is to help you live well, age well, and experience everlasting intimacy. I hope that y'all have signed up for the webinar. We'll be talking all about fibroids, getting down to the nitty-gritty of fibroids, how to control fibroids, how to decrease symptoms associated with fibroids, how to keep fibroids from growing, and control the symptoms associated with it, as well as talking about fertility and fibroids. So we're gonna have some great conversations on Thursday at 7 p.m. It's a free webinar. I hope y'all can join. If you know a woman, which I'm sure you do, because probably 9 in 10 women have at least one fibroid, but probably only 3 in 10 women actually have problems with their fibroids. But we will still want to know how to prevent them from growing and causing a problem in the future. So make sure y'all tune in for the webinar on Thursday. Comedian Joy, you always got a bunch of stuff going on. You know, I'm one of your biggest fans for the Eat, Drink, and Ride with Comedian Joy. So can you tell us what's going on with you and what new stuff you got going on with your travel and everything else?
Yeah, so on the 20th, we're going to have brunch at night. So typically brunch tours are during the daytime. We're going to have brunch at night. So Saturday night, July 20th, we're doing that. On the 18th, I'm bringing back my drinking event. We're going to have a rum tasting. Now, this is going to be
cool. When is that?
On July 18th at City Club Birmingham on the 31st floor, I think is the highest floor. So we're actually going to taste 3 of Diplomatico tastings, and we're going to have 3 different cocktails. So it's going to be a great night, great tapas that we're going to have. So it's going to be a fun night. 2 hours, we're going to learn all about rum. So I'm good at whiskey and tequila, but now I want to go ahead and educate myself on rums. And of course, the party bus is still moving. I'm trying to collect my final deposits for the trip to Mexico in December. But if you guys are looking to book a trip or want a vacation or anything like that, then you all can reach out to me. I'm booking that as well. And yeah, just still out here traveling. Today is my favorite holiday, Dr. Mia. So don't stop my hand. It's National Fried Chicken Day today.
Oh my God.
So I gotta go and support some of my restaurants and eat chicken today. However, you would have been so proud of me. I have been consuming much more salads and salmon.
Good.
Since my last trip, I'm down 3 pounds because I'm doing intermittent fasting with my food. And I finally heard you about weight. You cannot work off bad nutrition. So it's what I put in, and then when I work it off, I can start to look like you. It only took you 50 years for the light bulb to come on.
Well, it didn't take long at all.
No, it didn't. So yeah, so my plan is next time I come in your office and get on your scale, it'll reflect the weight I had like 3 times ago. Yeah, because sometimes when you're going up, my head is down, but I was like, oh, I was really somewhere 3 visits ago, so I'm trying to get back there. That's my goal.
That is the goal. Okay, well, wait a minute. I want to make sure y'all had a link. I'm gonna put the link for the webinar in here.
But they can also follow you at mebellawellness.com and see everything you're doing, because I follow you on social media, and that's how I learn about a lot of great things that you're offering. And you're right, a lot of the services and webinars are free.
They are free. Yeah, not services, but web.
Yeah, not the service.
Look, the webinars are free. But look, I'm gonna put y'all's link in here so y'all can join the fibroid fighters. That's what we call ourselves, the fibroid fighters. So we're gonna be talking about all the things you can do to prevent fibroids, to treat fibroids, to maintain fertility. So fibroids before you have your babies, fibroids after you have your babies. And we're going to hit on those wellness solutions as well. So you don't want to miss it. Y'all make sure y'all go and follow Comedian Joy on Facebook and Instagram. What are your handles on Facebook and Instagram?
Eat, Drink, and Ride Food Tours.
Eat, Drink, and Ride Food Tours.
Yeah.
So make sure y'all follow Comedian Joy, and I will see y'all. I'm gonna put it in the thing and ride food tours.
Next week, a week after. Well, tomorrow is Sunday. You and Joseph.
Yeah, so we got Asia's Intimacy tomorrow. Let me see what we're talking about, because you know I can't never remember from day to day.
So whatever it is, we know it's good.
It's gonna be so good. I forgot what it is, but it's gonna be good. So y'all look on my Facebook page, me Bella Health and Wellness, Mia Cowan MD, or just my personal Facebook page. And I will see y'all on tomorrow, Thursday, and then probably in the next 2 weeks, I'll see y'all as well. So y'all go live well, age well, and experience everlasting intimacy. Thank y'all for joining and spending your Saturday morning with me and Comedian Joy. And we will see you very soon. Bye.
Change your sweater drawers too.
Change your sweater drawers. Wash your JJ with some Dove soap. Put all that other stuff down and make you stink.
That part.
we can control the vaginal tissue. The yoni can be protected. Bye.
Yes.